Awesome. Thanks so much for joining us today, Dr. K. I really, really appreciate you being here.
Happy to be here.
Yeah. Yeah. And I'll just let parents know, hang in there. You may not see the connection immediately, but um, as we were talking beforehand, I started listening to some other hearing you speak on other podcasts and other presentations, and so many questions came to mind, both for myself and as a parent. So lots to cover today.
Mhm.
So before we really dig into the meat of this, I heard you say something once, that it was your own health journey that turned out to be your greatest teacher. And to me, that was huge. So if you wouldn't mind just sharing a little bit about your journey and what got you into practicing integrative medicine.
Absolutely, yeah. So, as a child, adolescent, I mean, even into my early 30s, I had bouts of pretty severe anxiety, inattention, just bouts of depression that would just kind of wash over me. And there was always a part of me that was like, why is this happening?
Mhm.
Why is this happening? And, other than, oh, you've got, fill in the blank problem, here's a pill, there was always this thing of, well, why is my experience of the world so much different than, most other people?
Mhm.
And when I was in my residency, what compounded this questioning was, for whatever weird reason, my brain just has this odd ability to kind of see things differently. And,
Mhm.
I remember vividly, we would have these kids come in, and there was this, I've shared this story before with others, but this poor guy, this 14, 15-year-old Hispanic young boy, was playing soccer, fell, got a little cut on his knee. 6 hours later, his knee swelled up, and then 24 hours later, he was dead.
Mhm.
And everyone else is like, oh, that was just, septic, disseminated sepsis, and we didn't give
Yeah, short
antibiotics
it off.
early enough. And, I
Mhm.
thought to myself, like, well, gosh, there are a lot of people that cut their knees and they don't die 24 hours later from that. Like, what was it about him
Yeah.
that caused him to pass? There were other kids where, their gastrointestinal tracts were falling apart, and, the team had done the medications and the medications failed. And they were like, oh, well, next course of action is just to cut out his intestines because, the colectomy is the next best option. And, for me, it was like, wait, that's so weird. First of all, you can't even
Yeah.
explain why his colon is so inflamed. He had inflammatory bowel disease. And like, if you can't explain why his colon is so inflamed and you're throwing these medications at him and they're not working, why are you just jumping to cut out his colon? Like, what about all this other stuff? Like, what about his diet? Oh, no, the diet doesn't work. Oh, supplements and probiotics don't work. And it was just this automatic knee jerk, like, none of that stuff works. So let's just
Mhm.
cut out his colon because that's the obvious and best choice. And there was a lot of these moments in with my own kind of background, like, why do I feel this way? And why do all of these kids have these odd things? It just brought me to a place where I started really questioning, like, okay, there has to be something more than the picture that I'm seeing.
Mhm.
And lucky enough for me, my advisor in residency was this brilliant doc who happened to be, at least semi curious in holistic medicine. And she's like, well, why don't you go check out, holistic medicine? Maybe it's an option for you. And I did, and instantly fell in love. And that was like 2006.
Mhm.
And here I am a few years later. And,
Yeah.
for me, the most beautiful part of this journey is the realization that there is no one singular answer. There's no one thing that explains everything for everyone.
Mhm.
And part of my journey in understanding why I feel the way I do and why the kids that I serve, experience what they do, whether it's airway problems or other things, is really constantly training in different mindsets and different modalities. And it's like the guy that keeps going and collecting tools. It's like, oh, I found the hammer. Oh, I found the drill. And like,
Mhm.
each medical system for me is a tool. It's a way of looking at problems. And I've just learned that the more ways I can perceive a given problem, usually the better I am at solving it. And by no means have I figured everything out. I'm still learning, and each day it's like, wait a second, what if, and then I go down
Mhm.
another rabbit hole, and that opens up a new way of understanding. But for me, that's what's so wonderful about this work, which is there are endless possibilities in understanding why kids experience what they do and why I experience what I do. And ultimately, through this, hopefully I can be better at helping these children heal and regain their health.
Yeah. And there are two things that before we get too far that you said that really struck me. One is that the children you serve. I love that way of looking at it. I mean, it's such a it sounds so simple, but it's such a very different dynamic, just a different way of looking at it. So thank you for that. And this holistic approach goes back to something that we've been saying for years now on this podcast. It is about looking at the entire child. Let's find the root. Let's stop just throwing pills at them and pushing them along because we're ending up with adults with problems we could have fixed decades before. So I love that approach. So, okay, now we're going to jump into the meat of what we're going to talk about today, but let's level set things for parents. We're going to be talking about molds and what makes them toxic. So, let's just start with exactly what are molds and how are some of them toxic to us?
Uh, yeah. So molds are everywhere, right? And without them, actually, life would cease to exist because they are the composters, right? They recycle materials, right? If a tree
Okay.
falls, it's the molds that decompose it. When we pass away, molds decompose us, right? They break down all biological matter into the most basic building blocks for it to be recycled. So they play a very valuable role in our ecosystem.
Mm-hmm.
And molds, it's true, molds are everywhere, as people say. It turns out, though, there are certain molds like aspergillus, certain types of aspergillus, like stachybotrys, which is the one that people associate with, the classic black mold. Chaetomium is another one, where these molds happen to produce certain toxins, certain compounds. And you can look at these compounds as almost they're like a gas. They kind of behave like a gas, even though
Okay.
technically it's not a gas. So they release this gas like thing into our environment. And it turns out that this gas like thing, these mycotoxins, mold toxins, happen to be very toxic to us human beings. And, the analogy or thing that I tell to parents is, it's fantastic when molds are out there recycling things. It's just really bad when molds happen to be attempting to recycle you, right? The living
Yeah.
human being, right? If it's your kid, it's even worse, right? So
Mhm.
when their effort and toxicity and what they do is now being directed at a living human being who is, especially in the early part of life, that's not a fantastic thing. And this is one of the big misconceptions. Everyone's like, well, every house has mold. It's true, but homes should not have certain types of toxic molds that only grow in indoor environments, usually when there's water penetration, because certain molds like the Stachybotrys, they're very, very finicky. They only like certain climates. They only like, it's like the family or person that only likes the 70-degree, warm temperature that's super comfortable, right? They can't stand too much
Right.
heat. They can't stand too much cold. These molds are very much like that. So a
Okay.
home that has some kind of water contamination or water penetration turns out to be the perfect environment for them. And that's when they start growing and then start secreting these toxins and other compounds that then start causing a problem. Now, what I want to add is we're learning that it's not just a handful of molds. It's like
Okay.
when you have a leak or some kind of other humidity problem, moisture problem, it's like they're throwing a block party and they're sending out invitations to all of their cousins. So now you get bacteria
Mhm.
that don't belong there. And it turns out these bacteria, these gram-positive bacteria, can start secreting their own toxins, which happen to be harmful to us. So you get this big party of microbes, molds, and bacteria,
Mhm.
and all kinds of other things that are now together creating this toxicity, and that collective toxicity is where the problems come from.
And, it's so funny. I mean, I guess a lot of people, you think, okay, inner city housing, okay, I can see where it's going to be there, but it's in suburban housing. And hearing you talk, the thing that surprised me, it's not just in our houses. There's other places that we're being exposed to this every day,
Yeah. So,
right?
absolutely. It could be in office buildings. I've seen it
Hmm.
in classrooms where there was a few times where I mistakenly thought it was the family's home, and it turns out that it was the child's classroom in the old church that happened to be
Hmm.
very musty. I've had families where, they thought I was absolutely off my rocker because they had moved into a 2-year-old custom construction, super fancy house that was, more expensive than I can begin to understand.
Hmm.
And it turns out that I'll give you one specific example. One of the 8 air conditioning units, imagine a house big enough to have 8 air conditioning units.
I can't, but
One of
okay.
the 8 air conditioning units in this super, super fancy house happened to be the air conditioning unit that was contaminated and ultimately causing the toxicity. Because when air conditioning units don't like, their drain pan isn't set up and moisture just keeps trapping, you can imagine
Mm.
all of that mold that can grow in the pan underneath the air conditioner or on the coils, and that becomes a thing. I've had scenarios where, again, really fancy, nice house, the one window that was right by the kid's bed happened to have been flashed improperly. And every time it was raining, water
Mm.
was just going straight into the wall, right around the kid's bed, causing an issue. And, you know, people think like you need to have your ceiling collapse for you to have a
Hmm.
mold problem, where it's like, oh my God, like, yeah, the water is about to cause that ceiling to fall apart. Rarely is it that obvious. Most of the time, people have no idea that they have mold, and it's certainly not something that's on their radar, which is why I'm so happy to be here to share this. Because through the awareness and understanding is how we ultimately can piece things together.
Right, right, and get a hold of it. And but it's not just the part that blew me away that I heard you talk about was it was in other things. I think the one that really shook me was medication. That, these are in foods and medications, and I mean we're being exposed to them in so many ways. How, how is this
Yes.
possible? What I mean, I know how it's possible, but if something's toxic, why is it being put in a medication, and why wouldn't that be something we're warned about?
I think there's so much we don't understand, right?
Mm.
So, for instance, with foods, when you look at certain grains and how they're stored, right? Most grains are
Hmm.
stored in big silos. And now, especially with climate change, pretty much every part of the country has massive downpours and flooding and so forth. And these grains that sit in this high humidity for prolonged periods of time get moldy. Now, even if we're not the ones eating the moldy grains, which
Hmm.
sometimes we are, usually those grains, if they're not fed to us, are fed to the animals, who
Right.
then consume these mycotoxins, and then those mycotoxins are passed to us, through the animal products we eat. So it could be in food, it could be in milk, because milk is obviously from cows who are then fed these grains. Uh, Medications, supplements actually can have the mycotoxins. And what really seems to happen is you kind of have this starting point of toxicity, right? Where
Okay.
between the foods we're eating and whatever else, everyone has a certain level of toxic load, we call it. Now, for most people, they can handle a certain amount of toxic load, and their bodies are, their guts and their microbiome and liver and everything are handling this in stride, and everything is fine. What seems to happen is once you add the environmental load on top of it, and you've got the glyphosates and plastics and these mycotoxins in our food and et cetera, et cetera, et cetera, they're right here. And then the environmental load now suddenly pushes it to up here. And you hit this breaking point where the system can no longer handle that toxic load. And now the gut starts falling apart, and the microbiome starts changing, and the immune system starts changing. And then there's this just cascade of
Mm.
events that take place, which then result in a host of different diseases.
Wow. And this can happen. We're not just talking about adults. We're talking kids. I mean, how early are we talking? in the womb, or and how does it present when it starts impacting the kids?
So we do know that mycotoxins are passed through the placenta. We
Okay.
do know that mycotoxins are concentrated and passed through breast milk. So it's entirely reasonable to say that we think that infants could be born with mold toxicity. Early on, and I'm still not sure if this is actually the case, but what I have suspected and started observing in a handful of babies now that I've been smart enough to identify this is it seems that early on, little babies who just have this off the charts colic,
Hmm.
and essentially from the get-go they just are wired. It's like having the 3-week old that has taken multiple shots of espresso, and they're just they
Yeah.
don't fall asleep easily. They cannot calm their nervous systems. They nap for half an hour and they're wide awake. And it's literally like having too much coffee for those who are sensitive, and you just literally can't calm your system down. So early on, it seems to show up possibly in this colic. And then from there, it can go on to show up as eczema. And I'm not talking a tiny patch of eczema, one part of the child's body. I'm talking, the eczema that keeps growing and it keeps spreading. And next thing you know, it's on multiple areas and it's angry and it's red and it's itchy.
Hmm.
That kind of eczema, it starts showing up as more and more severe gastrointestinal issues. So the kids that, it's not just mom has to get rid of a little bit of dairy if they're nursing. It's mom has to get rid of gluten, dairy, and eggs, and this and that, because the kid's gut is so insanely reactive early on. Or those poor babies that have to go on the hypoallergenic or elemental
Hmm.
formulas because they do not tolerate any kind of other formula. When you start putting the pieces together, you start realizing that this could be one of the significant contributing factors to that early presentation of these things.
Wow. And that statement in my back of my mind, I'm going through my children now. I'm going, oh, yes, I had one of those. And now this is one of those. I have to say it every podcast because it happens to me. You don't know what you don't know. Park the mom guilt. It's okay. We're learning. So let's just move forward from here. So, um, how does this present as we go, through older children, impacting their immune system and their nervous system? What might that look like?
Um, Before I answer that, if
Yeah.
I can just touch on what you said right before that,
Yeah.
um, I certainly hope that everyone who's listening, I mean, it's natural to feel guilty if all of a sudden you're like, oh my God, what if this was my kid?
Right.
And that's just being a good parent. The most important part of this conversation is how much you can do to reverse and treat this.
Exactly.
So if your child has had all kinds of different issues, nervous system issues, and we'll touch on this, immune problems, gastrointestinal issues, airway issues, obviously,
Hmm.
these are all things that you can treat and probably get your kid in the healthiest place that they've been in years by understanding this. So
Hmm.
what I would love to do is kind of reframe this picture from doom and gloom and oh my God, what if I've let my kid suffer like this, to wow, I have something that I can do to really help my kid, my family, myself become so much healthier.
Yeah.
And for some of those families that are listening and maybe early on in the process, how much you can do to prevent the progression of problems
Hmm.
by
Right.
actually addressing this. And part of why I feel so passionately about, speaking about this is from a treatment and prevention standpoint, the outcomes that are possible are staggering. And the way children and families can heal from all of this is amazing. So
Hmm.
I really hope that this information empowers you to really feel good about helping your family be healthier rather than sitting in a place of guilt and shame
Right.
and oh my God, doom.
Yes. Well said. And yes,
Mhm.
thank you. Okay. Seriously, every podcast we hit that point, and you can just, because I know I feel it. And so collectively, parents listening just have that. So we always have to say, just park that guilt. Just,
Mhm.
put it aside and let's move forward. Absolutely. So
Yes.
let's go back and talk a little bit about, ways that it presents and the way it can impact, their immune system or their nervous system.
Yeah. So the first thing is, let's look at the immune system.
Okay.
And you can just kind of look at it from a logical standpoint. If you have a competent immune system that protects the body, would that allow the mold and mold toxins to ultimately do their thing? Which is no.
Yeah.
So what's really clever about the mold and mold toxins is they actually start causing a weird disruption in the immune system, where on one hand, they essentially, you can't say they disable the immune system because they don't, but they suppress the immune system.
Okay.
And what you find in some children, about 10 to 20% of the time, is this weirdly low white blood cell count. So for families whose kids have had their blood taken, you'll see like normal white blood cell counts is typically about 4,500. And these kids are hovering around 4,200, 4,100, 3,800. So they're not like, heavens forbid, like cancer immune distorted, but their immune systems are just not functioning well. And how this shows up on the outside is the kid who just gets one infection after another, And it's not they get a cold and they fight it off in 2 days. It's they get a cold and they're congested and inflamed for 3 or 4 weeks. And then they go on to develop an ear infection. And now they have a pneumonia. And it's just this never ending cycle of illness after a complication from that illness. And then as soon as you've treated one illness, another one shows up. So that's one of the first things that we see.
Okay.
The second thing that we see is the immune reaction against these molds. So we have these cells, they're called mast cells, and they're kind of like the immune scouts of the body. Their job is to kind of survey, the terrain of the body and say, okay, is everything cool? Or no, is there a threat? And then they basically sound the alarm for all the other cells to come and fight whatever threat that's there. It turns out that mold toxins and molds themselves happen to be particularly good about just really irritating these sentinels, these mast cells. And when these mast cells get really activated, they start dumping out tons of histamine. So they start creating a lot of congestion. They cause a lot of inflammation. And the first thing that shows up as is just this constant faucet of mucus that just never ends. And it's just those kids that are congested all the time. And then because they're congested all the time, mouth breathing, right? Which then goes on to create a whole host of other issues. But those kids that are congested all the time, they get ear infections because they're congested. So their eustachian tube doesn't drain. So back-to-back ear infections, usually they end up getting ear tubes because they've had 15 ear infections in, not too long a period of time. So it's that chronic inflammation and congestion. And that same mast cell activity, that same histamine also can show up through the skin, which is where the eczema and all of these weird skin rashes. So sometimes the kids don't have eczema, but they get these hives that just come and go for no reason. And they're taking a shower and suddenly they get, hives that pop up and then go away. So those are some of the first fundamental things that parents will see. And sometimes, one child is presenting with something different, and then you've got the parent who's always congested and so forth.
Okay. And it can also be, I don't want to say this incorrectly, tied to or connected with things like ADHD and depression.
Mm-hmm. Yeah. So what we don't oftentimes talk about is the role of histamine in the nervous system. And to give, our audience context of that, think of a time where you or your kid or someone has taken Benadryl, and what that Benadryl does, right? You just knock out.
Sure.
Benadryl is an antihistamine. It's a very non-selective antihistamine, but it's an antihistamine. And what it does is it basically, if histamine is the air in the balloon that puffs up the balloon, aka our sympathetic nervous system, Benadryl takes that air out of the balloon and causes the balloon to collapse, which is why we pass out. Just the right amount of histamine is what we want, where it's not in excess, it's not too low, because if it was too low, we'd be, on the floor sleeping all the time. And what molds do to mast cells is by releasing all of this histamine, we're not just causing allergy issues. In some children, depending on their genetics and how they're wired, what can happen is these children suddenly have these nervous systems that just cannot settle down. So it goes back to what we were talking about in the little babies. And it's literally like the child has had 15 cups of coffee every day. But it's not just their nervous systems can't settle down. It turns out that beyond that just constant an inability to settle down, to shut down, histamine also modulates our sensory pathways. So
Okay.
how we perceive sound, how we perceive touch, our sense of balance, all of these different senses are actually in some way, shape, or form modulated or affected by histamine. So the vestibular system, which is our inner middle or inner ear, which controls balance, actually can be very much disrupted by histamine. And now how that shows up is this kid that just, cannot settle
Right.
in their body for the life of them. And these poor kids get in trouble. Johnny, sit down. Susie, why are you constantly moving, right? The parents are getting mad at them. Teachers are getting mad at them. Ultimately, we put them on a stimulant because that's one way to keep them still. But that constant movement is actually oftentimes a histamine imbalance. It also shows up as those poor kids that just get overwhelmed in loud and crowded environments. And there's a lot of adults actually that, as I talk to them, the parents like, yeah, that's actually me. It's not my kid, but it's me. So when there's that sensory overwhelm in an environment, a lot of times that sensory overwhelm is rooted in histamine imbalances. And it's almost like someone takes the dial of your sensory balance and, normal sensory experience should be here, and you turn it up to here. And all of a sudden, the intensity of the sensory world is dialed up so much that after being in an environment for half an hour, people want to leave. People get anxious. Sometimes what we see in the children that we, label as autistic, and these are kids that make perfect eye contact. They're talking to you, but they just can't socialize. They can't be in social environments. Why? Because they're constantly overwhelmed by their sensory experience of the world. And what's really amazing in these cases is you bring down the histamine levels, you calm down the inflammation, and suddenly these kids that are autistic are now, they're a little quirky maybe, but they're able to socialize and they're able to be in the world and they're able to enjoy the world, which is the coolest part of this.
Yeah, it would be. And it even goes as far as I heard you share a story about one patient. I believe it was her clothing. Just that just seems. That blew me away that it can really impact a child that much that they can have a reaction to the way their own clothes feel.
Yeah. Yeah. Tactile sensitivity, thank you for touching on that, is another reflection of the same thing. So our experience of touch, so how clothing feels on our body, a lot of times is also influenced by that. And a lot of these kids who have, and you can see there's usually a constellation. These kids, they can't tolerate tight bands. In the case of this one poor little girl, she couldn't even tolerate clothing. And again, as you dial down the histamine and rebalance it, all of a sudden these kids, tactile sensitivities go away.
And that could even, transfer over into what they eat as well as that is a sensitivity. We think they're picky eaters, but they're just having some kind of sensory reaction.
Yeah. Yeah. I think it's twofold for those kids. So one, some kids just say that food tastes really gross in their mouth. So the older kids have actually articulated that. And when you look at what some kids who are extremely picky eaters eat, it's chicken nuggets, mac and cheese, pizza, a handful of, easy to eat foods that are kind of neutral in taste and texture wise, there's very little involved and they can just bite and swallow it. And when it comes to really dense textures, aka steak, for instance, or mixed textures, that sensory experience is so overwhelming to these kids on the inside of their mouth that it becomes almost offensive And
Mm.
we just think, eating is pleasurable, right?
Right.
Enjoying certain things is so pleasurable, except for these kids, the act of eating is certainly not pleasurable. They eat for the sake of, sustaining themselves, but rarely is it an enjoyable experience because of that sensory overwhelm. Sometimes what also happens is the sense of smell, the olfactory senses change. And there are some
Mm.
kids who just literally cannot handle the smell of certain foods. And there are some families where literally the kid will just leave when the family is eating because of the smell.
Mm.
And that also then affects what they can eat and how much they can eat. And, as an extension of this, think of when you've had too much coffee, your appetite
Mhm.
goes away, right?
Mhm.
Your
Right.
appetite gets suppressed. And for some of these kids, compounding all of these other issues related to smell and texture in the mouth, their appetite is suppressed. So they kind of nibble a little bit all day, but they never get that hungry because their nervous systems, again, are just stuck at like 100 miles an hour all the time.
Oh my goodness. Wow. Okay. So if as a parent you're starting to put the pieces together and you're seeing some of these signs and symptoms that could possibly, I mean, obviously we don't know, but possibly be related to these molds and these toxins, where do we start? Can you just go to your pediatrician and say, could we check this where do we go?
Um, I think the best starting point is to first kind of zoom out.
Okay.
Because usually it's not one child. Usually there's someone else in the home that's having an issue. And that to me is the biggest red flag. And for adults, sometimes they can show up as congestion, sometimes they can show up, as anxiety or these sensory things that we talked about or whatever else. But the other thing that mycotoxins do is they disrupt the mitochondria, so they disrupt energy production. And when they do that, one of the things that really comes to light is just this lackluster energy state. And the kids, those are the kids that, run for 30 seconds and want to sit, or they just don't run at all. They just kind of sit and play quietly. Those kids that are
Mhm.
really not that active.
Yeah.
Sometimes as you put the pieces together, you see it all kind of fit into that very unified picture. There are a lot of adults that, you know, kind of normalize their fatigue. And, the common thing that parents say to me is like, well, I just thought, having 2, 3, 4 kids was the reason why I'm tired all the time.
Right.
And I never thought about it being more than that. Whereas in reality, it's not, I mean, their children are not helping, but it's their actual physiological state that's causing that. And be a simple thing that parents can do, and I can't provide medical, advice just on
Right.
a, podcast like this, but taking carnitine, just 500 milligrams of carnitine over the counter. Please talk to your doctor before doing anything. But taking carnitine sometimes boosts energy production. So as a litmus test, sometimes I'm like, take this, see if you feel better. And that becomes a data point. Brain fog and
Mhm.
memory issues are also oftentimes a sign that there's some kind of mycotoxin or other toxin exposure. So a lot of parents, what they'll all of a sudden start realizing is like, gosh, yeah, 5 years ago, I used to have really good memory, and my memory has just gotten progressively worse. And again, they chalk it up to, oh, I just thought that was just being a busy parent and having too much on my plate. So as these
Mhm.
pieces come together, a lot of times families will get to a place where they're like, God, yeah, this really fits the bill, and this can really be what's happening. If that's the case, the first thing to do, I would say, is to actually find someone that knows what they're doing. Um, Talking to your pediatrician or regular physician oftentimes leads to a dead end. There's a organization called ISEAI, International Society for Environmentally Acquired Illness. Um, and they actually have this incredible database of providers around the country and world who can help people who have been impacted. One of my dear friends and mentors, Dr. Neil Nathan, He actually has his own website, and he has trained hundreds of providers also in the world of mold. And these people are quite competent in helping as well. So by utilizing these resources, you can find someone who hopefully is, in your neighborhood or at least in your state that can help you start unraveling what's going on.
Okay. And is this the type of situation where you hear a lot about it, and I don't want to poo-poo everything you see on social media, so please, audience, don't take it that way. But you see a lot on social media. Detox is something that people talk about a lot. Is there some validity to it in a situation like this? I mean, is that course something that makes sense sometimes?
Yeah, yeah. Detox can certainly be a very valuable part of the healing process. I think when it's done indiscriminately and you're just kind of throwing stuff at the wall, hoping something sticks, that's when you're kind of spinning your wheels, or sometimes people actually get more ill as a
Right.
result of that. So detoxing and using binders like activated charcoal or clay or other compounds to start pulling these toxins out and doing other things to restore the gut could certainly be helpful. It's just, it needs to be done, with the help of someone that knows what they're doing to guide you through that process.
Right, which makes sense. And you mentioned the gut. Just quick thought on that. Probiotics are everywhere
Mhm.
now, and we're hearing it talked about so often. How does that help, or does it help at all with something like this?
So probiotics are fantastic. They can certainly help in the restoration and healing of the gut. When someone is living in a mold contaminated environment and they're hoping that their probiotics are the magical solution to fix their problems, that's like having your house burning down because of a gas line leaking, and you've got your little fire extinguisher trying to put out that fire, and you're wondering why the fire doesn't go out. And early on, I couldn't understand why some of my patients whose gut problems were there just were not healing. And finally I wisened up and realized, like, oh my God, it's because they have all of these, toxins floating through their system and through the exposure. And oftentimes when you control the exposure, the gut actually starts healing. And that's when the probiotics and other things can help.
Okay. And just kind of a general thought, because I know a lot of our listeners, they have humidifiers in their house. Especially if you have a breathing disorder, you hear a lot of, you want to keep the air moist. You want to keep it where, it's more palatable to your system. How does that work as far as, being a dangerous breeding?
Humidifiers could be super, super helpful, but when they're used with caution, because if you do take the humidity level of an environment past a certain point, you have now started creating a breeding ground for possibly mold. Dust mites can start growing. So, like, especially in really dry environments or climates, what I'll tell the families is at nights when your kid is sleeping, run the humidifier, get the humidity levels up so they can sleep. And then during the day, shut that thing off and let it dry. Because the a lot of times these humidifiers can get moldy themselves if we're not careful. So you just need to be aware of what you're doing and how you're doing it, rather than just, indiscriminately running a humidifier 24/7 and taking humidity levels to 70% all the time.
Right. Right. Living in a little greenhouse.
Yeah.
So at the end of every episode, I always like to hand it back to our guests, because you are the experts. And just leave the last word with you. Anything, final thoughts or messages for our audience?
Oh, especially when it comes to airway, I think this is an area that, as far as mold is concerned, is something that we have paid way little attention to. I have seen, obviously, that there's more reasons than just mold, but I have seen a significant number of kids who have chronic mouth breathing, and we do and they're doing myofunctional therapy, except someone has missed the fact that there's the mold exposure. So you're doing the therapy to kind of reorient the mouth and tongue, mouth closed, except the poor kid can't breathe, right? Mm-hmm. Because they're congested all the time. There's one published study that has demonstrated adenoid hypertrophy from mold exposure from an indoor environment. And, a lot of these kids, they start off with some mouth breathing because they're congested, and that then starts creating a cascade of events that starts leading to tonsillar and adenoid hypertrophy. And then a lot of times these kids end up getting surgery, right? And we're hoping that the surgery fixes things, which a lot of times it does. It restores the airway, but that congestion is still there. And that congestion perpetuates everything. And I've had, probably 4 or 5 cases where the tonsils actually grew back out. And the parents are like, what do you mean my kid's tonsils are back? And what do you mean they're having, obstructive sleep apnea again? We had these taken out 2 years ago. So, and the flip side of this is I've had a few cases where, with a lot of hard work on the family's part, we addressed the environmental exposure, took care of whatever mold was in the home. The family did a lot of work to change the kids' diet. So it was a low inflammatory diet. We did certain supplements like probiotics, immunoglobulins to calm down the gut inflammation. And all of a sudden, the kid that had these, big tonsils, obvious airway obstruction, slated to have surgery a month later, like the tonsils were still big, but they were no longer obstructing the airway. Kid was sleeping soundly with their mouth closed, snoring was gone, and all of a sudden it's this kid didn't need surgery. And there are times that I think surgery is absolutely the best course. And I'm the one pushing the families, those poor kids that are choking and gagging and they just can't breathe and they can't oxygenate. Yes. But there are also a lot of kids that we just charge into surgery as our first course of action, without standing back and saying, what is causing this poor kid's system to be so inflamed? What is causing so much congestion and buildup in this child's body that is then causing these cascade of events that are leading to surgery? And what if we nip things at that level to then see how everything else folds out? Because there's a chance that, I don't want to peg a percentage on it, but a fair number of kids that right now parents are looking at surgery as their only option suddenly becomes, oh, this is another option that can help. And sometimes it can help so much to the point where surgery is no longer even a necessary thing.
That would be amazing. Yeah. Thank you so much for being on here and sharing everything. And as I alluded to earlier, there is so much to this, and we've really just touched the surface. So I will be putting quite a few links and YouTube videos in our show notes so that parents can find out more.
Well, it was a delight to be here and to share this information with you and your audience. And thank you for creating this space and holding this space. Absolutely. To just inform the community and help parents learn more about these very important things.
Absolutely. Thank you.